So one really exciting possibility is harnessing the power of molecular genomics along with huge computing power to match donors and patients much more precisely and to stop patients developing red cell antibodies, which might make them difficult to transfuse in the future. I think there's also a lot of new knowledge about blood cells to be gained by using so-called big data, both on donors and patients, and putting the two things together to understand better the biology of blood cells. Donors are very willing to be normal controls in biobanks and in other studies. But all of this will need a huge investment in IT and laboratory technology. And we will have to take the public with us to give them confidence that their data will be used responsibly and held confidentially by the blood services and the NHS. The other development is, of course, in stem cell technology. And as we speak, NHS Blood and Transplant Laboratories in Bristol and Cambridge, with their academic partners, are manufacturing small amounts of red cells in Bristol and platelets in Cambridge in the laboratory, starting with hematopoietic stem cells. And it is planned that in 2020, small doses of those red cells will be used in studies in human volunteers, with the platelet studies coming somewhere behind. But these products, I think, will have to find their niche. I don't think it's particularly realistic to expect manufactured red cells and platelets to replace the entire blood supply in the forthcoming decades. After all, humans have evolved over millions of years to be extremely efficient bioreactors for the production of red cells and platelets. And a bag of blood from a donor costs not much more than £100, and that includes the tea and biscuits.